I don't see that there's a way that universal health care is not existing in some form inside of this country in the next, 10 years or so, or to 15 years. I mean, it's just a wildly unsustainable system. The amount of bureaucracy alone that exists in our healthcare system. I mean, a lot of people that argue for free markets argue about, everything should be a market for the reasons of, expediency and having efficiencies and all this. I mean, you could not imagine or create a more inefficient system than what we have with healthcare.
All right, welcome to the conversation. We're going to have a really interesting conversation about whether Oregon can actually get universal health care for its citizens. Is that really possible? And then what would be the ramifications of that? Is that a little experiment we could do in a state that could have huge positive consequences maybe for America? Well, we'll find out. Byron Campbell is joining me. He's with The Lever. He's also a volunteer for Healthcare for All Oregon. There's both good news and bad news coming out of Oregon. So first, welcome, brother. How you doing?
Good. I'm very happy to be here. Thank you so much, Cenk. Yeah, doing great.
No problem. So did Oregon pass a constitutional provision for universal health care?
Well, it's not exactly for universal health care, but in 2022, the state did pass a right through ballot measure. So the population itself passed this, a right to accessible and affordable health care. So that is now in our Bill of Rights, which we are the only state in the country with that constitutional right. So it is a pretty powerful springboard for any additional actions in healthcare.
Now, United Health, of course, is fighting back, of course, in a lot of different ways. Yeah. So we're going to get to that in a second. But first, so okay, what does that right mean? Does it have any practical effect, and are they trying to implement it?
Yeah, well, I mean, it certainly ultimately will have a practical effect. I would say that the state hasn't necessarily yet operationalized it, as in like no new sort of healthcare system is in place that addresses that specific right. But it is, again, I would say like a baseline that's been built that makes Oregon unique in this country as it works towards universal healthcare. We have our state government has put together a governance board that is right now, as we speak, working on a universal health care plan that will ultimately go to the legislature. And we're expecting it to end up as a ballot measure in the next couple of years here. But the actual shape that takes, we'll see. I think that the key thing here is that Oregon has set this baseline that no other state has set, and is now actively working towards putting forward a real universal healthcare plan. That has been, the state's been doing an incredible job investigating this since 2019 now. So it's a really thorough plan. The preliminary findings were that it would not just expand access to care, but it would save the state $1 billion a year almost, and like as when they were running the numbers for what 2026 would look like if we had this plan in place, or a plan. So it's pretty powerful and very possible here.
So Nick, look, part of the reason to do these conversations is to learn, right? And I'm trying to learn as well.
No, for sure, yeah.
So it's not fully formed, so it's really hard to put contours around it. But having said that. Like I've never really quite understood how I'm for universal health care, I'm for Medicare for all on a national level. At the state level, I've never quite understood how you execute that. Like how do you have a separate rules in Oregon and a different rule in the rest of the country?
Okay, so that's a really, really good and important question. And there's like a few layers to the answer. One is there is a precedent for getting waivers related to sort of federal laws or requirements. So in the 90s, actually, Oregon was at the forefront of Medicaid expansion at the time through the Oregon Health Plan. And that actually did require a waiver from Bill Clinton at the time because it was ahead of its time. It was not in compliance with all the federal regulations. And so, that is something that can be done. A waiver can be gotten from the federal government to allow things that maybe aren't currently sort of happening within the existing framework. we're attuned to the fact that the current administration may not be totally in line with where we want to go with this, but this is also an issue that has a longer time frame than just a couple years. So the administrations change, but beyond that, there are that's part of what the state's looking into, is these sorts of waivers or other ways that a plan can be activated. So yeah, that's actively being worked on.
Is it possible that insurance companies would pull out of Oregon, saying, well, okay, if you guys are going to make us cover everyone, we don't want it?
Well, no, this would be administered by the state. So, that sort of, it gets around that issue.
So then the state covers it, and it becomes what, then a kind of a public option within the state?
Mm-hmm. Yeah, exactly.
So then you could go United Health, or you can go with Oregon Health, for example.
Yeah, again, the final outline of the legislation is being worked on now, but I would say it would be more like you would go with the Oregon healthcare plan. You would be that the state would cover care, and that's I believe there will likely be options like wraparound options for if people want to get additional care. But again, these things are not necessarily set in stone yet here.
Yeah, look, I'm a little afraid because the states could. It's much harder, I think, I hope I'm wrong, to do it at the state level than it is at the national level. And so if it doesn't work, I'm afraid of how it'll be perceived. But if it does work, then we're in amazing shape. And since the national level is such a disaster and they're all crooks and they're never gonna do anything anyway, so you guys might as well try it. So go for it. And I had to.
Oh yeah.
Yeah.
Well, so I would just say a few. Well, go ahead, please. Yeah.
Yeah, no, I was just gonna say it's like with Mamdani. In this case, I actually agree with it. Mamdani has some policies that I'm so on, but try it. Let's see what happens, right? Because because the status quo sucks. So anyone telling me, oh no, change would be so dangerous. No, the current system is dangerous. But you were gonna say.
Oh yeah, well, I mean, just to what you said exactly right there, I would say the status quo in healthcare is beyond just not good. It's completely unsustainable. So I actually don't think this is an option. And should Oregon not succeed at this, I mean, call me crazy. I know it seems impossible, but a lot of things in politics seem impossible until they happen. I don't see that there's a way that universal healthcare is not existing in some form inside of this country in the next 10 years or so, or to 15 years. I mean, which might seem like a long time in some regards, but politically isn't that long. But I mean, it's just a wildly unsustainable system. The amount of bureaucracy alone that exists in our healthcare system. I mean, a lot of people that argue for free markets argue about, everything should be a market for the reasons of, expediency and having efficiencies and all this. I mean, you could not imagine or create a more inefficient system than what we have with healthcare. And so, I mean, healthcare for Oregon is nonpartisan, and I mean this in all honesty. I would have this conversation, and I think even a person that loves the idea of free markets for reasons of efficiency should be open to what this state is working on, because the status quo is so wildly bureaucratic and just difficult and not streamlined that I can't see how it exists in the current form for a whole lot longer. And so I just think Oregon's at the forefront of something that is going to happen in this country. I'd love to see Oregon be the state to do that. I hear your concerns about federal versus state. I mean, it'd be wonderful if the federal government stepped up here, and who knows, again, no one can read the future. Maybe something happens federally in the next few years. But I do think that states can be that sort of laboratory that, conservatives love to talk about that too, the laboratory of our democracy, the laboratories. And in this instance, Oregon is so well set up for this. The state has really done an incredible job of setting the stage for making this possible in a way that no state has ever done it in this country. Yeah. And I don't know if that answers your entire question.
No, it does. So look, and you're right that it's nonpartisan. Republicans want healthcare too. They
totally.
Right? They don't want their kids to get cancer and then they don't have health insurance, right? The only people who object are crooks, otherwise known as politicians. So now let's talk about the fight back. So United Health is going after Oregon Medical Group in Eugene, Oregon. Do you know about this? What's going on there?
Yeah, so through Optum and specifically Optum Oregon, which are subsidiaries of United Health, I mean it's massive, conglomerate. They have purchased medical groups in Oregon, and sort of most notably, they took over Oregon Medical Group in Oregon. Sorry, in Eugene, Oregon, and this is a medical group that has been around for a long time, but as I understand it, ran into some difficulties in the COVID era, which was not uncommon, and dealt with it by taking an offer from Optum. So now, they're being managed by this, subsidiary of a conglomerate, and the fallout of that has been pretty negative in the Eugene area. A lot of doctors left the practice. And then beyond just leaving the practice, there are non-competes written into these contracts, so they can't now practice in the area. So when Oregon Medical Group loses a doctor, it's not just that practice that lost a doctor, it's that area. And so this has left thousands of people without coverage. Sorry, not without coverage, but without doctors. So they have to go looking for care. There's been a marked increase in emergency room usage in that area, which can be, is often sort of a signifier that people don't have access to the primary care they need. And this is just one example. I mean, this has been happening around the country, and it also is happening in other parts of Oregon with other groups. Oregon Medical Group was just particularly large, and it had particularly large effects on the community there. So that really did become sort of a rallying cry for people that wanted to see reform. And that ultimately led the state to pass a bill this year, which it wasn't directly tied to this issue with United Health and Optum, but I think politically it sort of helped push that through. Senate Bill 951 here in the state, which aims to, and that was signed into law by our governor this year, and it aims to get rid of previous loopholes that allow private equity and corporations to manage and run most medical groups that previously were physician run. And the idea here is that when these groups come in, whether it's private equity or just large corporations, they're not looking at they may say otherwise, but come on, we all know their goal is not a happy community or a healthy community. Their goal is profit.
No.
Listen, even if I were gonna yeah, and I'll even give them the benefit of the doubt. It's like like that's fine in certain parts of life, sure, but not healthcare is deeply personal.
Yeah, I mean,
we all deal with this. We are all going to end up in a situation where we need it, and it cannot be driven by brutal market logic. It just can't.
So. Yeah, no, I'm given to understand by mainstream media morons that companies can be patriotic and they really care about our healthcare. No, they don't. It's like they're producing jeans or sneakers or burgers. They don't care. The profit is what they care about. In fact, they're not human. Yeah. They're not human. God, reporters are so stupid overall if they work in mainstream media. This is the lever, so they're doing great work. I don't know. Do they care about profit? Yeah, they legally have to care only about profit. You idiots. Yeah. All right. Anyways, you said two things there that's interesting, and I want to go back to it because I'm like, wait, really? So did you say, or did I misunderstand you, that they made the doctors sign non-competes?
Yeah, and that's part of what has been outlawed in this Senate Bill 951 here, or just they won't be doing that anymore. But previously, yes. So these corporations would take over a practice, do things to it that led the physicians to want to leave, but they signed these non-competes, so they couldn't just move across the street and practice. So, like I said, the real fallout there then is people lose access to their doctors.
No, that's unbelievable. Unbelievable. I want people to understand what that means. Yeah. That means, okay, hey, I signed up with you guys, but then now you're dirtbags and you violate every part of your contract, so I want to go somewhere else. Okay, you have a non-compete, so you can't work in this town, so you have to leave the state. What? Okay. Yeah. I mean, that's insanity. Yeah. So then the area is going to have less doctors. The doctors are going to be chattel to these corporations and can't leave them. So anyway, they got rid of that, but corporations always more, and I get it. That's their remit, if you will, right? But it's the job of our democracy to check these guys. Otherwise, they do ludicrous things like this. So one other thing you mentioned there, Nick, that I wanted to make sure you said. So did they now make a rule in Oregon that these practices have to be purely physician run and these private equity guys can't buy them anymore, or no?
I believe that it has to be 51% owned by, operated and owned by a physician. The actual law itself also takes some time to come into full force. So there is a period of time right now when there will not, where there won't necessarily be rapid changes as this happens, but yeah, the ultimate goal of it, and actually I should state, since the 1940s, Oregon has had a doctrine in place to try and avoid this. It's just private equity and corporations sort of found some fun loopholes where they realized they could have one of their own doctors suddenly manage a practice out here. And so Oregon has always technically been trying to mitigate this from happening, but basically loopholes were figured out through the years. So yes, now the state has put in place this law as of this year, where the majority stake is held by physicians, so that majority stakes will not be held by private equity or outside corporations, which then allow them to sort of make the operational decisions about how these places can run and operate.
All right, well, so this turned out to be a really encouraging interview because we found out that there's one state who is not giving everything to corporations, who's fighting back against corporate rule a little bit. So let's go Oregon. All of a sudden, we'll start rooting for the Ducks.
Yeah, there you go. It's very. I do want to drive home that Oregon has a unique opportunity here, and I'll just break this down. I know we're about at the end here, but I'll say this is sort of my way of describing it. There's sort of three elements to what Oregon's doing. We have the right. We got Measure 111 passed. We have a constitutional right to affordable and accessible healthcare. Number two, we have the plan. Since 2019, this state has been working. So there's nothing casual about what's happening here. The state's been officially working towards developing this, what would be the universal healthcare plan for the state. And then we have the fight as actually through the decades, Oregon's been at the forefront of, these kinds of issues on healthcare, but specifically in this last year, our legislature showed that they are willing to, take some strong stances against corporations in healthcare. So, this is a real thing, and that's why Healthcare for All Oregon. We are, we're organizing people now to get ahead of when the legislation hits the table, because it's going to be an intense battle. The people making a lot of money off the status quo are not just going to let a state have universal health care, and we're aware of that. And I don't say it as a negative thing. I look at it as a challenge that we're ready to take on, and if it can happen anywhere in the country, it can happen here in Oregon. So yeah, we're pretty stoked at Healthcare for All Oregon to be at the forefront of this.
All right, brother, that's my kind of language there. I'm ready for the fight. I want the fight. The fight's in Oregon, guys. All right, so I like it. So everybody go help out Healthcare for All Oregon. Okay, Healthcare for All Oregon. Everybody go read The Lever. That's where Byron Campbell works. The Lever is excellent journalism. It's the opposite of mainstream media journalism. They do really terrific reporting. We love those guys. And I like that Oregon is now telling corporate rule, duck you. Okay.
Oh man, I'm gonna steal that one. I haven't heard that yet.
Well, look, I'm a professional, not a big deal.
Yeah, I know. Yeah, you are. You got the juice. So.
Yeah, professional dad jokes here, 24/7. All right.
Love it. Yeah.
Anyway, Nick, you're awesome. Thank you for coming on and educating us. We appreciate it.
Oh, thanks, Cenk. Yeah, it means a lot. Yeah. Take care.
You too.